Hey guys, I'm Dr. Dawson, and today I want us to talk a little bit about the common nosebleed. The main thing to concern ourselves with nosebleeds is, do we have the common nosebleed, or is it potentially the sign of something that's more important? So the question to ask ourselves there is, do we have any bleeding problems anywhere else? Does your child frequently bleed whenever they're brushing their teeth? Do you see blood when they either urinate or have a stool? If they get a tiny cut, does it take a lot longer than the neighborhood children for that cut to quit bleeding? Do they have excessive bruising in places that are not supposed to bruise? Children frequently are bruised in what I call contact areas, places where they come in contact with the real world, their shins, their knees, their arms. But if they have a lot of bruising in non-contact areas, under their arms, between their legs, or behind their back, those are places we don't frequently have as much bruising. Any of those things might be signs that we have a bleeding issue, and that's something you'd need to talk to your doctor about. But assuming they do have the most common regular run-of-the-mill nosebleeds, those occur primarily one way. There's a little plexus of blood vessels on this middle septum of your nose, about a half inch to maybe 3/4 of an inch up inside your nose, where the little blood vessels are very close to the surface. And when your nose gets wet, dry, and kind of cracks sometimes, it'll crack through those little blood vessels and they will bleed. It happens a lot like on your lips. When your lips get chapped and you get a little crack and there'll be one drop of blood. The difference is when these guys crack, they're little pumpers of blood vessels, and they will pump out a lot of blood. If it happens to happen at night while they're sleeping, it'll cover the pillowcase. It'll look like a ton of blood, like perhaps a scene from the movie The Godfather, when they come in the bed is covered in blood. So that's frightening to parents, usually not a problem. The next thing that happens is then they get a little scab inside their nose, and that scab is there for the next week and a half or two, and they mess with it, and they pick at it, and that'll make it bleed again. And so frequently when you do have a nosebleed, you'll have recurrent nosebleeds over the next couple of weeks. The things we can do to try to diminish that: number one, just like if you had cracked lips, you put a little Vaseline on there. You can put a little Vaseline on your finger or a Q-tip and put that on the little area on this middle septum up inside their nose, especially at bedtime, and that will help. It helps to put a little cool mist vaporizer by the bedside, so the air that they're breathing at night is more moist, and it'll make the area less likely to be dry and cracked. It'll help to keep your child's fingernails cut short, so that then they're a little bit less likely to be messing with the scab that's inside their nose. Any of you that are using nasal sprays, those frequently will aggravate nosebleeds, and so the most important thing there is to keep the spray off of this middle septum. Most people spray things straight up their nose or toward the middle. That's really not where your nose goes. That's kind of just a dead end. So it's better, you want to spray things back and toward the ear on that side. So just point it straight back toward your ear on that side, and that'll put the spray more where it needs to go, and it will keep it off that middle septum, so that it'll be a little bit less irritating. At the actual time that you're having the nosebleeds, there's a lot of questions of how to make it stop. Fortunately, if you just put pressure on both sides of your nose, that puts the pressure right where that little plexus of blood vessels is, and that'll stop the bleeding 90% of the time. The problem is it takes their blood about 3 to 5 minutes to form a good clot. I mean, it'll quit bleeding quicker than that just from the platelets, but to form a good clot takes 3 to 5 minutes. So the problem is people will hold for a minute, check, hold for a minute, check. Well, every time they check, you have to start that clock over again. So what I want you to do, hold for 5 minutes straight, then check. If it's still bleeding, hold for another 5 minutes straight. And usually that will take care of the bleeding. The other big controversy with moms is when your nose is bleeding, should you lean your head forward and let the blood run out the front and get on your shirt, or should you put your head back and let the blood run down the back of your throat? I would say it depends. Normally I'd be for letting your nose lean forward, because when you lean back and the blood runs down the back of your throat, when it gets to your stomach, blood makes you a little bit nauseated. So unless it's a really nice shirt, I think I would lean forward and let the blood run out the front side. So those are the main things. Long-term nosebleeds is more a matter of how much it drives you crazy. If these occur infrequently and the things that we talk about, you're able to control them, I would just let it go, and your child will eventually grow out of it. On the other hand, if they are constantly occurring and it's causing you and this teachers at school and everybody a lot of difficulty and stress, then it might be worth a trip to the ear, nose, and throat doctor. And what they can do is actually cauterize or fry those little blood vessels in there, and frequently that will make the nosebleed stop. So that's pretty much all you need to know about the nosebleeds, and I hope that'll help you.